Sun announces junk food advert ban on London transport. The radical idea forms part of a simple 8-point plan they claim will arrest the crises within 3 years. They have likened Britain's failure to tackle its obsession with sugar to the influence that big tobacco companies had over smoking 50 years ago. The report by NHS consultant cardiologist Dr. Aseem Malhotra, Professor Robert Lustig of the University of California, San Francisco and professional Grant Schofield of Auckland University of Technology, is the first to propose a sugar tax on everyday food. It says, we should not wait decades to solve our current problems with sugar. Big Tobacco sowed doubt that cigarettes were harmful, confused the public, persistently denied their effects, bought the loyalty of scientists, and gave ammunition to political allies. Now, the science demonstrating sugar's role in diet-related disease is incontrovertible, but science alone cannot curb the obesity and type 2 epidemics. Opposition from vested interests that profit from diminishing society's health must be overcome. Their demands come a week after TV chefs Jamie Oliver and Hugh Fearnley-Whittingstall all called on the government to take a sterner approach to tackling childhood obesity. There is already a sugar tax on some soft drinks, but the duo suggested it should be extended to those that are not subject to the levy, including Yazoo and Mars drinks, which contain as much as 16 teaspoons of sugar. George Osborne: I'm very proud of the sugar tax. The experts recommend all labeling of added and free sugars are made in teaspoons for the public to easily understand. There is a ban on all sugary drinks advertising, including fruit juice, on TV and internet. Demand services and companies associated with sugary products are outlawed from sponsoring sporting events, despite there being 15 grams of fat and 4 grams of sugar in a Big Mac burger. McDonald's has been a key commercial partner of the Football Association for 15 years. And earlier this year the FA renewed its long-standing partnership with confectionery giant Mars, which is now the official supporter of the England men's, women's, and disability teams. In a no-holds-barred report published in the journal Insulin Resistance, Dr. Malhotra said, for years soft drinks companies' public relations machinery have pushed the lack of physical activity as a cause of obesity, when there is evidence to reveal that although sedentary lifestyle contributes to chronic disease, physical activity impact is minimal at best, and you cannot outrun a bad diet. In type 2, the pancreas fails to produce enough insulin, or the cells do not react to insulin, meaning glucose remains in the bloodstream and is not used as fuel for energy. It is one of the gravest health issues facing the NHS today. More than 4 million people in the UK are now blighted by diabetes, but a further 12 million are at increased risk because of chronically unhealthy lifestyles. It means 25% of the UK population has, or could develop, an illness that can lead to blindness, amputation, heart and kidney disease, strokes and death. Type 2 now affects 1 in 10 adults in the UK, with cases spiraling out of control because of the UK's obsession with sugary snacks. A new diagnosis is made every 2 minutes. The conditions costs the NHS £14 billion a year to treat, or £1 million every hour, with the number of prescriptions issued for the disorder rocketing by 80% in a just decade. The NHS Eat Well Guide says meals should be based around potatoes, bread, rice, pasta or other starchy carbohydrates, with low-fat dairy or dairy alternatives and unsaturated oils and spreads. preferable, but experts say this advice has replaced millennia of eating satiating and nutritious full-fat whole foods and turned us into a sugar-obsessed nation reliant on medication. Processed foods now make up half the average Briton's diet, with most coming from starchy and sugary sources. More than 2/3 of men and almost 6 in 10 women are now overweight or obese. Simon Chapman, for the Sydney School of Public Health, said, "If you want to control malaria, it's essential you control mosquitoes. If you want to control obesity, diabetes, and cardiovascular disease, you must control the mosquitoes equivalent, the food industry." The sugar tax, explained Tam Fry, chairman of the National Obesity Forum, said, "All the recommendations are laudable and the impatience of the authors is palpable to achieve their goals in 3 years, however, is going some. Their timeline depends on considerable vested interest opposition being overcome, and that won't happen anytime soon. In my view, they should be looking at 6 years before even half of their wish list is achieved. They will be lucky if all of it is by 2030, Diabetes UK said. Type 2 diabetes is a complex, serious condition, and solving the growing crisis will not be an easy, or quick fix. Bold action from government and industry is needed to help consumers make informed choices about their diet, and ultimately improve the health of the nation. That's why Diabetes UK has called on the government to commit to introducing mandatory front-of-pack traffic light labeling on all pre-packaged food and drinks, and urged cafes and restaurants to provide calorie and nutritional information on their menus. This will help the public understand not only how much sugar they're consuming, but also about the fat, saturated fat and salt, all of which are harmful in excess. Reducing the amount of added or free sugar we consume is absolutely the right approach for a healthier diet, but it is just one aspect of a broad and complex issue. However, for a healthy diet, people should also be eating more vegetables, fruit, whole grains, nuts, pulses, and fish. We should also be eating less red and processed meat, refined carbohydrates, free sugar and highly processed foods.